submission, yes.
And also true to the best of your knowledge and understanding, you wish to stand the evidence of the Commission?
I do indeed. I could almost add to it.
I'm sure you'll have time to indeed do. Could I ask you first, in your non-personal capacity, your Save Our Hospitals capacity, for some views about the consultation phase of events? First of all, can you help with, very briefly, with your involvement in the consultation phase and your experience of it?
My involvement was more limited because I had to be back in Australia looking after my mother who had had a fall. But what I do know is that, and this partly includes me, that a very large number of the local population did not, only found out about the proposals coincidentally, that many of the public meetings were meetings where it was very hard to get local views heard and where it gave very clearly the impression that it was pretty much pre-decided. I have to say that the written consultation document actually had closed options, which meant that there wasn't space to raise a whole lot of issues that people had about the proposals.
Did you, in your attendance and knowledge of public meetings, were you able to form a view as to whether or not all sections of the population were representatives of all sections of the population, or did you feel that some may have been excluded or not represented?
I think that's very hard to actually assess if you went at a wide range of meetings. What I do, probably minority ethnic groups were underrepresented, even when the consultations were in parts of the borough where they would be, where minority black people would be the largest percentage of the population. Certainly the meeting that I attended at Phoenix School was significantly underrepresented by a range of ethnic minority groups. I think almost more to the point was the way that those meetings were structured, that it was extremely difficult to raise the sorts of questions that local people actually wanted to ask.
Pause there for a moment, Mr. Green, I see you want to come in.
Yes, one or two points I would like to ask, and to add to what my colleague said, that is that some of the meetings were very, very badly advertised. Where one not part of a circuit of people who were interested in public health, one would not know the meetings were taking place. And I do recall one meeting at the Hammersmith School, chaired by the then Director of Finance for Imperial, Mr. Bill Shields. When he was asked about the limited circulation of knowledge about a public meeting, he quite simply shrugged and said it had nothing to do with Imperial. And I do recall going into that meeting where there were a number of customer services people, if I can put it like that, with a pile of documents much higher than these, who wanted anybody who came into the meeting to sign up for membership of Imperial there and then. But that was an evening where, going into the meeting, the staff at the door did not know the nature of the meeting into which they were admitting people. So in terms of willingness to consult, it was quite the opposite. It was customer sales rather than consultation.
Just pause a moment, because your colleague was telling us about what she felt were the difficulties in local views being held. Can you just amplify a little bit how those meetings took place and what it was that you say caused difficulty in those views being given airspace, if I can put it that way?
The one meeting I was able to attend, it was a platform.
So I think Mr. Green has to turn his off, so you can turn yours off. Yeah.
The meeting that I attended, there was a platform of speakers. There was very little time for speakers to speak from the floor. And interestingly, a number of those speakers from the floor were actually medical people who seemed to have had sort of a prior conviction, if I can put it that way. In other words, there wasn't space for an adequate debate about the issues. I don't think that sort of public meeting anyway is the way to actually get at the views of people about their health services.
What should have been done, in your view?
First of all, people should have known much more about it. Secondly, there should have been a different sort of discussion forum, I think, to actually enable people to express their views. And I have to say that the CQC's meeting, although rather limited prior to the inspection of Imperial, was a better mode of actually hearing what people had to say, because it spoke to people one-to-one and allowed the space for people to raise their issues.
Now, just in terms of the basic premise of the consultation that was put to the public, can you help with your view about whether the premise of reduction from 9 to 5 major hospitals was in wide enough ambit or not?
I'm not quite sure what you're...
There was a pre-consultation stage at which a number of options were whittled down to 3 options which were placed before the public. Those options were all premised on the reduction of acute services in 4 out of the 9 hospitals. And what I'm seeking to ask you is your views from your campaigning point of view as to whether or not that was an appropriate way to proceed or not.
I think it's quite clear that we would think it was not least because of the support we have on the street week after week, and by this stage, year after year. It was a pre-decided issue. They even, in the consultation papers, had a preferred option. And it was quite clear they were deriving the consultation to get the answers that they wanted. In other words, to support the preferred option. And as I understand it, a lot of the submissions that were, for example, petitions and so on, which represented thousands of people's views, were counted as a single submission.
Now, I want to move on from that aspect, and I want to ask you about something you've touched on in your submission, borough-wide provision. Just in terms of Hammersmith and Fulham, can you help us with whether there is an even spread over the borough, or is there a discrepancy between provision in different areas? Sorry, rather a long question. And if so, what's behind that?
I'm not sure I could say what's behind it, but I think one of the things said our hospitals did was to actually send round, which I think we have submitted to you, our response to the the review panel.
You're referring to the independent reconfiguration?
Reconfiguration panel, yes. What we decided to do was that we were quite pleased with it, that we ought to let GPs see that, and we actually hand-delivered to every practice, to every GP in every practice, as well as every practice manager, a copy of our response to the independent review panel with a covering letter. The 2 of us actually did that entire delivery. The part of the borough we happen to live in is in the south of the borough, and it is quite clear that there is a greater density of GP surgeries and GPs in the richer south part of the borough than there are in the north part of the borough, where the GP surgeries, a lot of them are rather run down, some of them are single doctor surgeries, and they're spread further apart. So there are quite clearly differences in the 2 parts of the borough, and they do relate to wealth.
Are you able to perhaps...
Could I add to that?
Yes.
One of the factors which we have looked at is the relative affluence between the quite rich south, for the most part of the borough, and the very poor north of the borough. We know that life expectation is shorter, chronic conditions are worse in the north of the borough, yet public health facilities really are very sparse. And in the part of the borough we happen to live in, one has an immense choice of doctor surgeries. In the north of the borough, there are fewer far between, and public transport links in the north of the borough between surgeries is not very good. And furthermore, many of the people in the north of the borough are old people who need public transport, therefore they have no choice.
Now, bearing that in mind,